I'm Nicholas Ward, and I'm the training program director for the Alpert Brown Medical School Division of Pulmonary Critical Care and Sleep Medicine. So my decision to come to this division was a bit of a surprise to me. I was actually looking at a lot of other places, a lot of other cities, and stumbled across this job interview. Didn't know anything about Rhode Island, didn't know anything about the people here, and came on sort of an exploratory interview. But after meeting with Mitch Levy and Sharon Rounds, I was surprised to learn what a wonderful place this was, and piqued my interest. And I decided to learn more about the institution, and Rhode Island, within a couple of weeks, had made up my mind to come here. And that was 16 years ago. And I don't think if all goes well, I will never have to leave here. I like it so much here. So the research environment here in our division, it's extremely varied, and it ranges from bench research in places like the VA Pulmonary Vascular Lab to clinical research in ICU outcomes, such as the research done by Mitch Levy, to all sorts of things like tuberculosis research by Jane Carter through her work in Kenya and Ethiopia, and a lot of new pulmonary vascular clinical research being done by Corey Ventitulo and James Klinger here. Additionally, in the last couple of years, the division has started to grow even more with the addition of Dr. Barry Shea, who came to us from Boston, who is beginning a research program in interstitial lung disease. The addition of a new dean of the medical school, Dr. Jack Elias, who's actually a prominent pulmonary critical care physician who was the chief at Yale for many years. And Jack is, even though he's not specifically in our division, will be working with our division in a research capacity, providing opportunities to our fellows in collaboration with our researchers for many years to come. My academic time mostly focuses on work I do with the professional societies. So I've done a lot of work in the last couple years with the Society of Critical Care Medicine through the internal medicine section and some task forces on physician staffing in ICUs, coming up with guidelines. I also do a lot of work with medical ethics, and I've been on the ethics committees of the Society of Critical Care Medicine and the American Thoracic Society for several years now. I'm also on the medical ethics committee here at Rhode Island Hospital. So I do a lot of writing on that, and I do a lot of task force work for medical ethics and ICU staffing and ICU utilization and rationing. What I hope for this division going forward is that we continue to maintain the breadth of opportunities that we have. I always, when I speak to incoming prospective fellows, I always tell them that what makes this a wonderful division is its balance, that it is a place where a young physician can come and get an incredible exposure to clinical skills and clinical training, the likes of which match any institution in this country, but at the same time have the opportunity to do a wide range of research experiences. And these two aspects of the division are offered in a very balanced fashion. So it's not too research heavy, it's not too clinical heavy. Our ultimate goal is that a fellow who comes to this institution can graduate ready to practice in any scenario or any situation in the country, whether it be an academic institution or a clinical private practice, that they're ready to go.